I think women are disproportionately affected for a number of reasons. One is, as we mentioned before, just the biological reasons that make them more sensitive to stress, but they're also primary caretakers. And so, they're sitting at home, taking care of kids that normally would be in school, trying to make sure they get their education. At the same time, they might be working moms that are trying to balance this whole situation of helping their kids, with their education, and then also trying to deal with their work. And there's going to be a loss of women in the workforce because of this, and it's really a tragedy. I think it disproportionately affects them. We know that also other factors in vulnerability to this crisis are going to be, do you have social support, the environment, socioeconomic status? Do you have access to health care, access to good quality health care? So we know that this crisis is really that African Americans and Native Americans, that minority populations are incredibly vulnerable to this. Part of this is pre-existing health conditions, but also some of these socioeconomic conditions and access to healthcare as well. So there are a number of factors other than biological.
Yeah.
You mentioned coping. So, just to go back to sort of animal experiments, we did some very interesting experiments on coping styles and how that changes the brain. And in this particular experiment, we sort of had it was a social stress experiment where we have a bully rat, right? And we put a rat in the cage with the bully rat, and the what we call the intruder can have different kinds of coping styles. They can become subordinate, go into this subordinate posture, like I give up, or they can kind of fight back. And what we found was that the guys that became subordinate had a less effective endogenous opioid stress coping system. So we have endogenous opioids in the brain that kind of tone down the norepinephrine system, for example, and help the system recover when after it's been activated by stress, and when the stressor is terminated. This is like a recovery system. So these coping styles, this subordinate coping style, was associated with a less effective endogenous opioid stress coping system, if you will. So coping is very important, and maybe training ways of coping can be very helpful.